In some advanced all-on-4 plus cases, different implant combinations may be required. Bone atrophy is a loss of bone mass and structure that happens once natural teeth are lost. This results in a loss of available bone to accept regular implants, exacerbated over time by dental problems which are unattended, for example, infections from teeth, gum disease, and even the wearing of a denture. This limits what approach can be used when planning implant rehabilitation down the track. Patients with advanced atrophy of the jaw sometimes do not have the necessary minimum volume or quality of bone required to have conventional treatment with dental implants. Zygomatic implants are longer fixtures which, instead of relying on the inadequate jawbone, transverse the poor area of the upper jaw to anchor into the underside of the cheekbones. This method is used when the upper jawbone is very thin, porous, or weak. The placement of zygomatic implants is done from the inside of the mouth and along with one or more regular implants in the front part of the jaw on each side. In some of the more complex or atrophy cases, we may need to use 2 zygomatic implants on each side of the upper jaw, providing maximum stability and support for patients with severe bone loss. This is known as the quad zygoma technique, and it's often the most effective option when the upper jawbone has resorbed significantly and cannot support traditional implants alone. By anchoring the implants into the cheekbones on both sides, when done correctly, quad zygoma offers a stable foundation even in the most challenging of cases.